All right, it is Thursday, April 9th. Just to start with an update of kind of where we're at. This is based on my call last night through all the community physicians in the Valley. So 226 cases right now, 27 hospitalized, none in the MATSU at this point. Testing, apparently the long-term goal, and I have to say I didn't get to listen to Dr. Zink last night because I was on this call, but apparently long-term goal is to have maybe 3 tests available for everybody. But kind of one of the main limitations is this testing medium, which has been the case the whole time. In terms of the hospital, they're doing super well right now with capacity. Metsu Regional has, let me get back to that, sorry. Capacity meaning they have capacity for a lot of people. We don't have any people right now in the hospital with this. Matsu has tested 214 patients. As of yesterday, 191 negative and 23 were pending. And then some guidelines came out yesterday, which I have not seen yet. And it's basically HAN, which is an acronym for Health Alert Network. And apparently what they're doing is liberalizing the testing criteria. And so that theoretically people with more mild cases can be tested. The caveat to all that is that we still don't have a whole bunch of tests. So even if we have the criteria say we can test everybody, and I don't know how many of you got to see the Matsu Borough update yesterday. I don't remember what, maybe at 11 in the morning or something, but Dr. Erickson spoke on that. And the whole, the issue is he said we probably would have enough tests like for 2 days and then we'd be flat out of tests. So the number of tests in terms of availability is still a rate limiting factor for us. And, there's a variety of reasons for that. But number one, people worldwide are looking for them. And I will talk more about that. And I actually made a little bit of a handout that I'll share and go over with you guys. In terms of personal protective equipment, PPE, the hospital, everybody's tight on their resources right now. They are grateful for a huge outpouring from the public. And when people are bringing in cloth masks, cloth gowns that can be laundered and those sort of things, they are using those basically with low-risk patients. So everybody's efforts that's been helping has been really, really great. They now are reusing some of their respirators, and they figured out a way to sanitize these. But each person in the hospital gets, has their own equipment. So it's not like equipment's being shared. That's kind of the update. And then I am going to share my screen. Let's see if I can do this effectively. I'm gonna have to hop around here a little bit. Okay, can everybody see basically my Google Doc here? Hopefully. What I wanted to do is talk a little bit about the lab testing. So just to make sure that people understand what some of the verbiage is and get a bit of an understanding. I don't know how many of you know I'm a PE major as a background, not a typical science background, although I like science, but this has not been my education background. So when you talk about PCR testing, and that's what we're doing right now, that is called polymerase chain reaction testing. And this is where they use that nasopharyngeal swab. So if any of you have had a flu test where they stick that swab way up your nose, that's what this is the same sort of testing, similar swab. And the goal of this is to get actual virus, so RNA from the virus. So in the lab, the sample gets treated so that it preserves just the RNA that's present, gets rid of the rest of the stuff. Enzymes are then added to this, which basically transcribes that RNA into DNA. The DNA then gets amplified. So if there was one little, a couple little chunks, then we get a whole bunch of those same little chunks. So it makes a lot of copies. Each lab, excuse me, this is where it gets into like some of these tests being different than others. Each lab uses a specific set of coronavirus DNA fragments. So they have the known virus genome. So they pick, and we see this with the flu vaccine, because each year you see like, oh, it's a H1N1 in a, whatever. There's always like a few different things. So they're guessing which things are going to be most prominent that we're trying to create antibodies for. So what they're doing with this is they're taking specific fragments of that coronavirus DNA, and then when they run that sample through, if there's complementary viral fragments, it basically will stick to it. It'll bind, and there's a fluorescence in there, and so it lights up. So if people have ever seen something called like a Western blot for Lyme disease, you get these little, you have a little, you have your known, or take a pregnancy test. That would be really easy. You know where the control is, positive, negative, and where does that line show up? It's the same way our strep tests work and way our flu tests that we do in the office. If the line doesn't show up there, it's negative. Well, this is a bunch of different lines, so we're trying to match lines. So that's where you can see like, this could be good, it could be bad, and there's also variability there. So the fact that there's different companies are using a little bit different regions. And so when the CDC made this test initially, it ended up being a failure. What happened is it identified specific bands of that coronavirus appropriately, but there were also, one of the chemicals was causing non-coronavirus particles to react like they're positive. So we got all of these false positive tests. So it basically, people were testing positive when they didn't have it at all. So when this happened, and we're, this is a few months ago, or a couple months ago now, when this happened, then this caused the FDA to grant what they call an emergency use authorization. So what does that mean? Basically, the testing process doesn't have to go through this long, prove your test works really well kind of process. Because usually you can't say, I made a test, here it is, can we use it tomorrow? I mean, generally, obviously, that's a no. As of March 30th, 20 of these EUAs have been authorized, something that I just got in an email this morning, and I'll flip to that when we get through this little part. It appears to me that there are more, and I'll walk you through this chart that I literally got right before we started, so I haven't looked at it so much now. In terms of, the key to the PCR test, which we even talked about last week, you have to have active virus to detect it. So, and that's where there's another potential problem, if you're just not shedding enough virus, or the swab doesn't get the right spot, there's all of those things. There are currently some point of care PCR tests coming out right now. What does that mean? So point of care would be, if any of you have been in here, and we've done a monospot test, we've done flu swabs, they're basically tests that we can do at the point of care. It'd be the same thing if we run a metabolic panel or a lipid panel here. Those are things we can do at our point of care. So in the most part, these give results in less than an hour, which is nice. These are the tests that they were talking about getting into the villages now, and some local testing facilities will get them. These can be really helpful because it expands our testing. The limit to these, though, is you can only run one test at a time. So you can only churn out tests, as fast as the machine churns out tests. So it will be helpful to us, but it isn't going to get us to that, like, we've tested a whole bunch of people. The traditional PCR test equipment can run almost up to 100 samples at a time. So like at the state lab, or all these tests that have been done through some of the urgent cares around, like they're sending them off to Quest or LabCorp, who are running a bunch of tests at a time, but there's travel time to get the swab to the testing facility. They're batching these tests to run, and then results are coming back, which is where that delay is happening right now, which we're still dealing with. The other kind of testing that is coming on board, and I know you've all heard a bit about, is serology or antibody testing. So these tests basically search the blood for antibodies to the virus. And so that can help us down the road detecting who's already been exposed. Now, there are some people who could clearly have been exposed, could have tested positive, and maybe still won't create antibodies. That doesn't happen a lot, but it does happen. I know people who have gotten their hepatitis B vaccine series, all of them, and their antibodies are negative. And that can just happen. And we know that can happen to some people. So we have to take this for that worth as well. The other interesting thing about serology or antibody testing, it can take up to 8 days to develop antibodies. So it's not super helpful right away. These tests aren't widely available right now. I think there are some of these tests being used in Asia that we could potentially get here, but I don't think there's any widespread real antibody test happening in the States. If you guys have been watching the news at all, you've seen where sometimes they're trying to get the plasma or serum from people who've already been infected and recovered, and they're trying to purify that and use that to help bolster somebody who's currently sick's antibody response. So there's lots of different treatment things going on that potentially that could be helpful for. And then let's skip a little bit, and I want to talk, and I don't know how much statistics you guys have had. I've taken a college class, and I'm not convinced that I know it a whole lot better. But when we talk about some of these statistical terms, when we talk about tests, the really important things that that you're going to hear, and I want people to understand, is we look at tests in terms of, sensitivity and specificity. When we look at the sensitivity of a test, basically that is the ability of a test to result positive when somebody actually has a disease. So if you have COVID, your test is positive. That's where we look at the sensitivity. When we're looking at specificity, what we want to know is if you test negative, are you truly negative? Right now, some of the sensitivity around this testing we're guesstimating around 70%. So that's where some of the problems. So, that's telling us if you have basically a false negative test, you actually could have it, but your test is negative. That's based on that whole viral load. Or with those initial CDC tests, people were testing positive, but they didn't really have it. So, and right now, I actually just tried to look up the Roche test, and that's one of the most common ones. And even on the health practitioner data, it didn't give me the specific sensitivity and specificity for the test. And whenever we look at any testing, whether it be a strep test or any of those things, we have an idea of what this sensitivity and specificity is. So take a rapid strep. The rapid strep actually has a pretty high specificity. So if we do a strep swab and you test negative, it's about 96% accurate in that you're negative. But sometimes, I send off a culture, and sometimes, 4% of the time I will, contact you 2 days later and say strep's positive. So, and that's really important, because when we have, and another term, not to try and confuse everybody, another term is using negative predictive value there. So if I test you and that test is negative, it gives me that confidence in saying, I really don't think that, you have this. So that's the idea behind specificities, sensitivities, negative predictive value. This I will post for all of you guys as well. And hopefully this will help. And there's a couple helpful links here as well. One other thing I want to, well, here, I'll show you that. Here's the Roche thing that I looked at. So I think sometimes people think I get all this great information that you don't have access to. And anywhere on here, there's nothing about it. So it's not super helpful, unfortunately. Here's what I just got this morning. And this is basically through a group that I'm connected with through the Institute for Functional Medicine. So this is actually pretty neat. So fighting the pandemic, this was actually published on the 1st. So 41 regulatory authorized diagnostic tests, 23 human clinical trials in terms of treatments right now. There are 5 vaccine trials right now. So that's pretty interesting. You can see the most of these tests are this PCR test that we just talked about. There's only a few of these point of care tests. The rate limiting step of these point of care tests is going to be, each of these things has like a little disc, and you need a little device, you know, that's, I don't know, they're not very big. We have like our urine analyzer and our hemoglobin A1C analyzers are these little test modules, and they all need a specific disc. Every test needs a little disc. So the rate limiting step is going to be the discs. So it's going to be, you know, similar. So here's like diagnostic tests. This, I guess, here are the 20 of that emergency use authorization. You can see different times here, result times. 7 of them are less than an hour, 23 are 2 to 8 hours, and then 11 of them are 12 plus hours. So they've already discontinued a handful. This talks a little bit about treatments. And basically, there are 6 different trials for treatments for symptoms, things working on anti-inflammation and then antiviral growth. There's apparently 30 plus preclinical trials right now. So that's actually pretty interesting. There are 41 currently in development preclinical vaccine candidates. That's pretty interesting. And then this talks about different vaccines. This gets into who is actually doing these different tests. So that's pretty interesting. Different treatments. So, and I'm sure some of you guys have seen some of these things. They're ongoing in the United States. There's a handful of different drugs that are used in HIV being used. And you can see like one has already failed a trial. There's another broad spectrum antiviral medicine that's failed a trial. There's different meds that will treat hepatitis C. There are some different things that we can talk about at different times. You can see this is a pretty common one, and IL-6 is interleukin-6. There are herbal things we can do to address some of those things. But this, I will actually post this as video so you guys can actually see this, and I can throw this. I'll put this link on the resources. Different vaccine information, which is interesting. I don't know so much about the BCG vaccine, which is a tuberculosis vaccine, and I have heard, I have not read much about that. They're actually, there's potential if that is actually helpful in this. So that's really what I'm trying to think. I'm gonna stop share again. The other interesting thing is, see, local testing, hospital, capstone open testing now in Palmer, as well as their Wasilla location. Lake Lucille Urgent Care has testing, and as does the Matsu Urgent Care off of Bogard and Cruzy. So that is super helpful as well. So looks like we have a question. Yes. I think, yeah, these pandemics really help us in terms of like, what do we each need to do to be prepared for these things. You know, a couple of the questions that I had gotten were, you know, diet, nutrition. I did, I posted on our Facebook page, and I can throw a link. One of my pediatric colleagues down in California wrote a really nice, basically blog post about supplements, and then not only supplements and nutraceuticals, but also, you know, what foods do you get vitamin A from, vitamin D from? And that I could, maybe I can actually pull that up as well. See if I can find it here quickly. And then I'll throw the link on here. And I think that this is super helpful information as well. And her last blog was really great. Here we go. And some of you guys might have seen this on here, but, you know, talking about foundations of a healthy immune system, you know, and I love this. It's kind of the same thing. You know, you can't supplement an unhealthy diet, or, you know, you can't run your way or bike your way out of an unhealthy diet in the same sense. But she went through in this, I'll post a link for this reference, really neat about, you know, zinc, top zinc rich foods. Those kind of things are really helpful. Quercetin, what are top quercetin rich foods? Quercetin's a really great supplement to be using right now because it also helps with allergies. And so we're seeing some overlap, as you're aware right now, with people starting to have allergy symptoms, you know, just that runny nose, that sneezing. So people are wondering, like, am I sick? Is it just my allergies? And that's very common right now. I would say for the most part, if you don't feel sick, you're probably not sick. It may well be your allergies. But in here, top vitamin C, rich foods, glutathione rich foods. So this is really helpful, and I'll throw the link to this as well. And then other questions that I had, see what other questions I'd gotten. You know, cleaning off grocery packaging before bringing them in the house. I'm not doing that. If it makes you feel better, you can do that. I don't know that that's a big vector in this transmission. Somebody asked actually about me, if I was helping at the hospital. We are a long way from me helping at the hospital at this point. And yeah, my primary responsibility, I feel like, is to all of you. And that's where my primary responsibility will lie. I would say if there were to come a time that the hospital would need my assistance, we are in a much more unfortunate position than we are today, for sure. So I'm gonna actually hope that we just don't even get there. You know, somebody brought up this path of isolation, and that makes me think a little bit about talking in terms of, we need to talk in terms of physical distancing instead of social distancing. And, you know, physically distancing 6 feet apart, you know, and not, you know, spending time with people that aren't in our immediate family. Those things are all appropriate. But in terms of social distancing, I'd really encourage people, if you're not using something like the free Zoom platform, FaceTime, Facebook Messenger, Google Hangouts, like all of those different things, use those things. I have, like, I end up FaceTiming my mom probably every couple of days just to check in and make that visual connection too. Um, you know, getting on a chat with friends, you know, where you actually can see each other. And I know younger kids are used to using those kind of things. I mean, I think some of us who maybe didn't even grow up with cell phones, like the whole idea of this being able to see somebody while you're talking to them, that's been a bit of more of a leap for me. Like remembering, oh yeah, I can do that. That's really helpful. And I think more of us doing those kind of things are really, really helpful. So I think that's really important to do. And just because we have to physical distance, you know, try, if there's somebody that you know that you can think of that might be elderly or that really is isolated in their home for whatever reason, because they don't want to get sick, because they have different uh, comorbidities, chronic illnesses that may be playing a role. For those people, it seems it's really important for each of us to reach out for those folks. Um, see what other question we got here. Yes, we need social connections for our lungs. So yeah, this does tend to get into lungs, and I can find there are a couple of different exercises that some respiratory therapists and physical therapists are talking about doing, that you can do some different breathing exercises, and I will post a link to that um, when I get this posted. So let me post a link. One thing I also like, let me write this down, exercises. One thing I do like is, especially as a mucolytic, something that breaks up mucus, is N-acetylcysteine. That can be very helpful. It's been shown helpful in the past with influenza, and so that could actually help a little bit. It's actually one of the key things. It supplies cysteine, which is basically the rate limiting step in creating glutathione, which is our master antioxidant. And so when you get sick, and when our body's fighting off some of these things, whether it be toxins and pollution in the air, or a virus or specific infectious disease, we create all these oxidative, we create free radicals. And so we need glutathione to help our body kind of tamp those things down and keep them in, you know, under wraps, really. So lung-wise, NAC, I think, can help. I will post a link to some breathing exercises that I've seen, and it basically has to do with being in a prone position. So I'll post that. That's a great question. Um, any other questions or comments? Anything you'd like me to do, address, or? Yeah, I would agree. I think there are a lot of people right now um, that are dealing, I think a lot of people are dealing with depression, and you know, maybe what I'll repost too is I'll repost that talk that I did on resiliency, and perhaps I'll reach out to Laura Porter, who we had just done that talk a couple months ago on nutrition and mental health. Maybe I'll reach out to Laura and see if she wants to do a joint talk with me on maybe, boy, I can't even say just depression, because I think people are experiencing levels of anxiety, depression, and even, you know, overwhelm with all of this. Because I think, you know, fortunately and unfortunately, that we are at a place right now that we've not been before. And so I think that makes it really, really hard, because none of us really knows exactly how to deal with this. And I think we're each kind of trudging through it as we go. And so I think, yeah, reaching out to people and connecting, and really use like those video features on our phone to see people. And we all know you can talk to somebody and they say, I'm fine, or all of, you know, somebody just says, oh, I'm fine. But, you know, it's different when we can look at one another and see, just see what people look like. And I think that that's super important. Let's see. Yeah, I will post up the vaccine and medication trial information. I could probably, I don't know if it will help. I'll post it in the newsletter. Um, yeah, I would. Oh, the smell tracker, huh? Okay, see, yeah, I think a lot of seniors don't have tech, and that's really hard. So I would say at least at a minimum, we got to reach out to those people and talk, on our own. Um, oh, smelltracker.org. I don't know what smelltracker.org is. I'll look that up and I can share that link as well when we're done. Um, yeah, so a lot of you have probably heard that a lot of times people can lose their sense of smell with this, and that's in part due to the virus, and probably in part due to zinc uh, levels as well. And so zinc is another one of those important things um, right now to be uh, probably supplementing or eating. And kind of the highest sources of zinc are clams, oysters, some of those things that I think some people love and a lot of people don't. So that's a little bit more challenging. Zinc lozenges, if you can find them, are really great. They are next to impossible to find right now. I can't find any through any of the distributors that I've used. So we do have some zinc capsules in the office here, and I think when you go online, you can occasionally get those. Somebody did ask me something about full script as well, and I would say if anybody ever has a problem with full script, contact them. They're really good about making things right if something has happened. Um, so um, I don't know, other questions? Would exercising, you know what, I think unless you are, I would say my caveat with exercise, though the question is, would exercising that really works out our lungs help? Um, yes, exercise every day is going to help. I would say, for anybody, if you're sick, I'm I'm not ever going to say don't exercise, but like if you feel like you're sick or you're coming down with something, don't go out and push yourself really hard because your body's already under stress. So getting exercise is super important to do, um, but do what you're, listen to your body. Like if it feels good to go hard today, go hard. If there are days that I'm sure we all experience that you're just like, I don't have it in me today and I'm going to go for a walk. Go for a walk. I think it's really important right now that everybody get outside, try and get in the sun as you can. That's super important. um, Open up windows in your house, let some air move. I mean, I know it's still pretty cool out, but none of us want to be in a space that's just got contained air. um, so open up windows and get fresh air. So, but yes, otherwise, using your lungs, taking deep breaths is really important. If any of you have the Heart Math or Inner Balance apps where you're doing that heart rate variability, that's really good right now. Really for most of us, trying to get enough sleep, managing stress are so important right now, because those things, if we're not sleeping and we're constantly stressed, we can eat everything right, take, all the appropriate supplements for us individually, and your immune system's still going to take a hit if you're not getting enough sleep or if you're under stress. So really important to do what you can in that regard. So I really like nature. So everybody should just try to get outside. If we were in Florida, I would tell you to go outside and get in the grass barefoot, but we're not there yet. It'd be a little bit cold. Yes, planting seeds and getting ready for spring. Um, I don't know if so I bought 2 weeks ago basically it's a tray yay big. for sprouting that I got on Amazon, and that's been really fun because I can make sprouts, and that takes just like a few days. They're super nutritious. So yeah, I would say that, and I've got a couple of starts going. So I think, that also gets into our food system. If we have capability, if we have dirt, if we have a pot, some people have planter boxes, some people have gardens, but anything, we can all grow some things, and that's really really easy. A little container garden even of just some lettuce. And so I did get something started a couple of weeks ago, so I have some little shoots coming up as well. So I think, yeah, gardening is a good thing to think about right now, and it's a little bit easier to think about right now because it's not windy and it's sunny and relatively warm out right now. Oh, that's awesome. So for most of you might be able to see this, the apple packaging from Costco makes a great seed planter. That's a that's a brilliant suggestion. Thank you. Yeah, I would say, like, I mean, you can even start with egg crates. Um, I mean, you're going to go to the store at some point. So if you go into the store at some point, you can always whip through and get one of those trays of starters. That's a really easy thing to do. Um, Boy, you could start things in Dixie cups, and we could all get really creative. And eggshells would be another thing to use. Um, so, yeah. More questions? Maybe not. I think we addressed all of them here. Yeah. Okay, so you guys, let's stay well for another week. I'm going to see what I can address of a few of these questions in a newsletter. I will post what I reviewed with you guys, that handout, and then I'll also put a link on there with the webpage that we looked at together as well. And let's see, if you need anything from the office, just please call us. We can, if you don't want to come up, if you need a supplement that we have, you can pay over the phone. Gina or Salita will run it down to you in the car. And then on Fridays, I have chosen to close the clinic at noon on Friday. If you need anything, please go through the normal route of calling. If you press 4, it comes through eventually to my cell phone. I'm still on the portal. This just allows Gina a little bit of time at home, and we haven't really been getting much in the way of phone calls or visits on Friday afternoons. So for her mental health, I just decided to close at noon and let Gina have a little bit of time at home too. So please let us know if you got that Google form and you haven't filled it out, fill it out, please. If you have other things that you want to add, or shoot me a message through the portal if there's something else you'd like to review. So if that's it, you guys have an awesome weekend, okay? Stay safe and well. All right. Thank you. Bye.